Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. Today we are reporting 40 new cases of COVID-19 in Windsor and Essex County. 19 are close contacts of confirmed cases. 3 cases are related to outbreaks. 4 are community acquired and 14 cases are still being investigated. We have had 12,374 cases since last March. 388 people are active cases at this time. 51 confirmed cases are currently in the hospital and 10 people are in ICU. Our community has lost 343 people to COVID. 222 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 27 active outbreaks in Windsor and Essex County. 11 are in workplaces, 12 are in long-term care and retirement homes, and there are 4 outbreaks in our hospitals. This is a very busy week for our health unit vaccine teams who will be working with long-term care and retirement homes to complete second doses of the Moderna vaccine. Second doses will be administered to residents, staff, and essential caregivers throughout the week and upcoming weekend. And based on our schedule, we will complete second doses by end of day, February 18th. We know that 376 residents are awaiting first doses, and we are working on getting this accomplished as well. In addition, we have asked our hospital partner to work on getting the remaining staff and essential caregivers of long-term care and retirement homes vaccinated with first doses when they are able to do so. We know that there are more than 1,700 people who would like the vaccine and have not received their first dose at this time. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick, limit your close contacts to your household members, maintain a 2-meter distance from others, wash your hands often with soap and water, use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. Thank you for accommodating your schedule for a delayed start today. We were in a different meeting that we couldn't change. So thank you for accommodating that. So a couple of points that I want to touch on, obviously in addition to what Teresa mentioned, is today's our first day back at the school. In-person classes for many who chose to send their children to school. It is a really important step, and we can understand that there may be some anxiety, some concerns among parents about sending their kids to school. We know that we have still have ongoing cases in the community, but not to the same extent that we have seen in December or even in November. Our cases are in the downward trajectory, and we hope that we continue to see that happening. It is critically important that we do not think that sending our schools to kids means that the risk has gone. The risk has not gone away. We still have a significant number of cases in the community, and we want to make sure that people, when they are out and about, they continue to follow the same measures, same precautions as they have been following for at least last couple of months. So it's critically important that we do not miss that line. When you're sending your kids to school, make sure that you are screening them properly. You want to make sure that if they have any symptoms, if they come in contact with anyone who is sick, please keep them at home to keep everyone safe at the school. For the school staff, please make sure you monitor your symptoms. You ensure that if you have any symptoms, you do not go to work, especially if you're to avoid putting anyone at risk. Within the school, make sure that you are not congregating together, especially for staff, and to maintain the cohort that each of these class cohorts are maintaining. So these are all the important messaging that we need to remind people regularly to make sure that we continue to keep our schools safe. The second point I want to touch on is the potential announcement from the province with respect to what is happening for the lockdown or versus not lockdown or stay-at-home order. We don't know at this time. Our public health in Windsor-Essex County Health Unit was not consulted in this matter, but we are aware through the media that there may be some announcement that may be happening. Doesn't matter what happens with the announcement, our local messaging will continue to be the same to make sure that we keep our community safety and priority at the topmost concern. We know that what we have accomplished when we had cases in excess of 200, and now we are down to less cases. It only happened because of these measures and people following these measures. So I don't want to give anyone any wrong message based on what the province announcement would look like. We need to follow these measures. We want to make sure that everyone is doing their part. When there may be some loosening of the restrictions happen, people must follow these measures. And most importantly, if you are working with a high-risk population, you must follow these measures. So all of these things are really critical. And lastly, I just want to point out to the importance of vaccination and the vaccine strategies. So we want to be really careful about the target population and how we want to target these population who is at risk. We know two things about the vaccine. One is the vaccine is good for preventing the severity of the disease. We do not have any evidence in terms of vaccine, if someone is vaccinated, that they will not contract the disease. So even when you're vaccinated, you may still contract the disease, but you may not show any severe symptoms. So based on that reason, so anyone who is, first of all, who is getting the vaccine or who has already received the vaccine, make sure that they continue to follow the public health measure. It's not the excuse for them not to follow these public health measures. So it's critically important that people who got the vaccine who follow that. And the second part is based on the severity piece. We want to make sure that the elderlies and the people who are more likely to develop severe disease are vaccinated first as soon as possible to prevent any severe consequences in that population. We still are working with the province to make sure that the prioritization process is as clean and as directed to the people who are most at risk, and they should be the one who should get the vaccine. Further details are awaited from the province, but we really hope that we start vaccinating our most vulnerable in the population, people who are dying, that are the elderly in our population. So we have to really look at the age-based criteria for vaccinating people and the people who are at a high-risk neighborhood, high-risk communities. And so all of that work will continue to happen at the provincial level as well as the local level. So I just want to make sure that I touch on these topics, and then we'll be happy to take any additional questions today.
Okay, we'll now take questions from the media. Is there any questions from AM 800?
My first question is for Teresa. Teresa, has the second shipment of the Moderna vaccine arrived?
So we did receive the second shipment on Friday. So we have received the same amount that we received for the first shipment. So we're able to give the second doses, on schedule and move forward.
Okay, thank you. Then a question for Dr. Ahmed. Dr. Ahmed, yesterday was Super Bowl, last night was Super Bowl. It's kind of maybe an odd question, but I know the states do things differently. But there was about 25,000 people in that stadium outside. They were having parties and everything. Like I said, I know the states do things differently. When you see that, what goes through your head? Because obviously you and the team here locally, through the province, and our country are doing things different. Just want to get your thoughts on that.
Yeah, no, it is concerning because obviously it negates the entire concept of what we are trying to achieve when we are talking about reducing any opportunity for people to congregate. And as clear as I want to be in terms of our messages even go all the way up to the point of, when we are planning for the vaccine rollout. this is also one of our consideration. We want to make sure that we are not putting up these massive vaccination clinic at everywhere, just for the reason that we don't want people to come in close contact with each other as much as possible. Our area has been hardest hit. And with the concerns about the COVID variant, we don't know what the situation would look like. So our plan, even when we are thinking about how would we roll out the vaccine in the most safe manner, we are trying not to rely solely on these mass vaccination clinics. We want to make sure that these people, they are dispersed everywhere so that the opportunity for anyone sick coming in and infecting others would be low. So yeah, it is definitely concerning to see any opportunity when people are gathering together, not for essential reason, but for any other reason that is putting a lot of people at risk. So I cannot comment further on that, but hopefully we don't have to see things similar in our country. And I really hope that our measures will continue to find that right balance of giving some opportunity for people for their mental wellness, but also not putting anyone at risk. So it's a very fine balance, and I really hope that we don't have to cross that line and to ignore those public health messaging in the midst of everything.
And the reason I asked that is because just for myself yesterday, sitting at home watching the game, in my head I was like, I'm watching the game alone here. There's 25,000 people in the stadium and outside of the stadium. It just, I don't know, it just things, I know it's a different country and they do things different there. It just seems odd because we can't even have small businesses open here. And I know you don't make that decision, but just overall, I think when people sit back and they see some of this stuff, that's why I think sometimes people question it. Is that safe to say?
Yeah, no,
not questioning COVID, but just some of the restrictions.
Yeah, no, I hear you, Rob. It is a question, and it's a valid question, and that's why I feel like the pandemic is a challenge because there are different voices out there. There are different things that people are watching, and then everyone is trying to understand what it means for us. And as much as we are trying to present facts and information that is relevant for our community, and we've been doing this right all along just to make sure that we stay focused to what is important for our community, what would be the right messaging. And if you can recall and appreciate, we have always been very clear what the overall goal is and where there is some flexibility that we can look at. But I hear your point, and that has been a concern, which I cannot control in this day and age, especially when everyone has access to media and people may have their own opinion. Our country, I want to give credit for that. We have been very focused in terms of our priorities. Our priorities for our community has been the health and the well-being, and all the other measures that goes into it. Not to say that the economic well-being is not important, but I think our governments have been proactive, and we have been also supporting the idea of how do we support everyone in this difficult time, not only from the health perspective, but even from the financial perspective, even from the economic well-being perspective. So there are a lot of work that still needs to happen. But I hear you, and it's unfortunate that some of these events, it takes away from the real public health messaging and could potentially give a false impression and false message to people to think that maybe we are doing things wrong, or maybe we're not thinking what we should do. I think Canada has been a leader in public health for many reasons, and we will always put the safety, the health of our community at the topmost level compared to anyone else.
Thank you.
Any questions from CTV?
Yes, good morning. Dr. Ahmed, you mentioned that you don't know what the province is going to announce today regarding reopening, but what would you recommend for this region? What do you think should happen?
Well, I think as I have always said, that the public health measures are the critical piece. When you have lots of cases, when you have lots of community spread, the likelihood of someone contracting COVID and passing it on to others will be high, especially if there are more opportunities for people to gather. So we continue to see that right now there are a lot of restrictions, at least that are in place. People are still, maybe some people are still doing some of the things, but again, the risk in the overall community is decreasing. And we may see an opportunity for us to maybe gradually release some of these restrictions because of some of these balancing act. At this time, I want to be absolutely clear that despite whatever the recommendations comes from the province, we as individuals, we as businesses, we as the community members, we all have a responsibility to follow these measures, because that's the only way we can keep everyone safe. Not only our family, our loved ones, our neighbors, our relatives, our businesses safe. So we all have to do that part, and we have to follow all these measures. We'll have to wait for what the province announced, and then maybe we'll have to go back and look at what this means for our community, and if there are any additional things that we need to put in place to keep our community safe.
So are you saying that if, once the province does make their announcement, if there are other things that you would like to see in place, then you will make further recommendations?
Well, obviously, the intent is to keep everyone safe, and we have done that in the past too. We want to make sure that the balance is achieved, and we're not putting anyone at harm's risk, or we're not putting our community at a risk of an increased spread, because we still have daily cases in excess of 20, 25, or today it was close to 40, which is a significant number. So I think these fluctuations we'll continue to see, and we want to make sure that we have things in place to prevent it from getting worse.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Dr. Ahmed, you mentioned several times now prioritizing seniors for the vaccine and using age as the criteria. So I wanted to ask you, are you advocating for the province to change its vaccination criteria? And if so, what response have you received?
Well, yes, I've been advocating for the province to use age as the most important predictor for the vaccination, and also on top of that, we also have to look at the burden of illness, where the burden of illness is, and which community and which regions have seen the worst of the impact based on that criteria. We recognize that that's not the only thing that goes into decision making. There are many other things that people need to wrap their head around in terms of the vulnerability, in terms of the various socio-demographic indicators. So we understand that part, but even within the priority and sub-prioritization, the one thing is very clear. The people who lost their lives, even in our community, 95% of these deaths are in the people who were 60 years and older. So if we're really trying to protect save lives, if we are really trying to go with what the vaccine does, which is reduce the severity of the disease, that's the population that we should be targeting. So I think we just want to make sure that message is out there, and we will continue to do our part, and we want the province to use age as the most important criteria in making some of these decisions.
But there hasn't been any response so far to that message?
Well, the conversation is ongoing. As I said, that there are a number of tables that are set up for having this type of discussion, and through the appropriate channel, those thoughts and those messages are being conveyed. And obviously, when we are participating on those discussions, those are discussions until a decision is finally made.
Okay. If you don't mind, I'd like to ask a question about your epidemiological summary on Friday. There was a sharp increase in the number of tests with results processed within 24 hours and 48 hours on your graphs. I'm wondering, is that a result of having private lab capacity right now? And if so, do you think, oh, sorry, please.
No, go ahead. You finish your question first.
I was going to say, if so, do you think it will help us keep a tighter lid on cases since people are getting the results in a more timely manner?
Yeah, no, I don't think that I can give you a breakdown whether this was a result of the private lab, but the private lab in Windsor, we are definitely counting on them to increase their capacity to help support the community. I know they have a little limited capacity at this time, and they are working on increasing their capacity as we speak. As we are thinking about the schools reopening, the first thing that we Teresa and we had the conversation on is we want to use this local lab to fast track any of the test results that we need for the schools, especially if we want to track the infection and if we want to identify any new case in the school population and any work that needs to happen. Maybe we need to use them so that we can get the results within the 24 hours timeline to expedite our case and contact management. So that's definitely will be helpful. And as we move forward, when the capacity of this lab increase, which my understanding is it will go all the way up to 1,000 tests a day locally, which would be a huge success for our community because that would really bring the case count, the time to process the test results very quickly to help us track all of these cases and isolate them immediately. So we are looking at that capacity to continue to build and use it for our community to get the public health measures in place very quickly.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. Teresa, you mentioned that you're working on getting some of the, I think you said around 370 people their first doses. Was there enough vaccine delivered that you can start those as well, or you're still waiting for another dose or another shipment for those ones?
So we, right from the beginning, we monitored our vaccine supply based on the numbers of residents, essential caregivers, and staff in long-term care homes. The initial direction was to give the vaccine to residents, and then later on, not long after, we were told that we could expand it to the staff and essential caregivers who had previously been going to the Pfizer clinics. So right now we are focusing on giving all second doses to everyone that we gave first doses to. So that includes all three categories in the long-term care and retirement homes, residents, staff, and essential caregivers. However, with our current supply, we know that we will be able to provide first and second doses to the remaining outstanding residents. So right now it's 376. Probably a week or so ago, I might have said 400, which was the number at that time. And as we're being very careful with the actual vial and knowing that we have to, once we open a vial, we only have 6 hours to use it. We're really monitoring the supply. And so now we're down to 376. We hope that number just keeps going down and down. But yes, there's enough vaccine for the residents to have their first and second doses of the Moderna vaccine. After that, we will need more, we'll need more shipment to continue further, as Dr. Ahmed talked about other groups. We don't have any vaccine for Moderna other than giving second doses and making sure these residents have their first and second doses.
And at this point, is there any indication of when you would get additional shipments? Or obviously, I know you just got your second shipment, but is there any indication of when we'd get more?
Not at this time. Early on, it sounded like the shipment would come monthly, but all we know is what we did get in the first, the first week in February, and so based on that, we can hope there's another shipment coming the first week in March, but that's not been confirmed yet.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Teresa, the 1,700 people approximately that you said are still awaiting vaccination, are they, just for clarification, were those specifically staff and essential caregivers at long-term care retirement homes that you want to seek the Pfizer vaccine?
Yes, so based on our numbers, and we've had contact daily with every home, and as you know, we're going into the homes and supporting them with the second doses, but we're confirming numbers of any outstanding staff and essential caregivers as well. And so based on our numbers, and they're very current, I know the hospital has also reached out, so the numbers are a bit lower, but we believe there probably more than 1,700 staff and essential caregivers that would be eligible in this prioritized group to get the vaccine. So we are asking, for them they'll have to go to the clinic that's currently at the Sportsplex and work through their long-term care homes there's a whole process, but that's exactly what we have talked to our hospital partner about is getting this, these other groups completely vaccinated. So it would be with first. So if there's 1,700 people, they would have to make sure that there's second doses for them as well.
And last week, when you did a very extensive presentation about the updated vaccine rollout plan, you presented detailed information about who had already received the vaccine and how many doses of both Moderna and Pfizer had been given out in this region. Is there any way that we can have that kind of vaccine information updated regularly?
Yeah, we would like to, we're working on all of that, and the communication piece of the vaccine rollout. We understand that it is, we want to be transparent and make sure that our community are quite well aware of who's next and what has been provided so far. So we are working on that. I'm looking at Mike, but we know that that's part of our strategy is to have our website updated with more vaccine information and to make sure people are aware of where it's going and who it's going to, and the actual vaccine supply that we have in our community, which helps to explain why the prioritization is so important at this time when there's not an abundance of vaccine available.
Thank you for that. And then, Doctor, is there concern that the Premier's announcement today might contradict your public health messaging?
Well, that's why the messaging is important. And as I said, the Premier have so many other things to worry about, which, and I can appreciate that it's not an easy job for him to do, but my focus will continue to be the health and how we can keep the focus on health. And even from a messaging perspective, I think the messaging is really important, that how we message it. Opening up or easing restriction doesn't mean that the virus has gone away, and I want to repeat that message again and again, that easing off these restrictions doesn't mean that the virus has gone away. The viruses still exist. Virus still is circulating in our community. So it is really important that we follow these measures to keep that transmission low and almost to the point that it doesn't the transmission is is gone in our community, which I don't know. I hope that it will someday. But having said that, I want the community to understand that where we are today, it's because of the measures. It's not because the virus has gone away. So we have to follow these measures if we want to keep the numbers that way and want to make sure that we're saving lives. There are less people dying. We are keeping our schools safe. We are keeping our long-term care homes and retirement homes safe, and we are protecting everyone around us as well. So I think irrespective of the messaging, these measures, it works. It helps to bring cases down. It helps to reduce the mortality in the community, and we can only move forward when people continue to follow these measures. So please, please, please do not let your guard down. If there is any announcement, if there's any loosening of the restrictions, we have to play our part. We have to keep everyone safe around us and our community safe.
Thank you.
Any further questions from AM 800?
No, thank you.
CTV?
Yeah, just one more question. The province said they're working on a rapid testing system for schools. Is that something that's going to take place in Windsor-Essex? Have we heard any updates on that?
So, good question. When we're talking about these rapid testing facilities, so it means different things for different people. What the province basically intends to, just like I said, when talking about the private lab in Windsor, our goal is to use our private lab as soon as possible if we have any concerns with the school outbreak, so that we can prioritize it and we can take actions immediately. So similarly, some of these facilities is not available in other communities. Some of the communities also don't have the ability to do that mass testing like we did with Bagley and with other schools. So there is a lot of differences in different community. What the province is doing is they are trying to help level the playing field. So in any community, if there's any concerns about an ongoing risk of an outbreak, or if there's any transmission happening in a very concerning way in a school, so every health unit will have the ability to send a rapid team to do the testing, and then if they don't have the ability to do it, the provinces are also looking at contracting a third party who can go in and do the testing and send the specimens to the lab, so that everything can be expedited in a very quick manner. So that's the whole intent of this testing plan. As we said, Windsor-Essex, we have already gone through that route, and we do have those systems in place, but we would also try to leverage what the province has to offer and to do more of that case finding and expanding our outbreak investigation as needed in our community. So there is no plan to go and from school to school to school just to do the testing for the sake of testing. It would be based on case identification and expanding the outbreak investigation as needed.
Okay, thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.